Hello, everybody. Welcome back to Clinical and Health Services Research. And we're going to be talking today about treatment systems and research on treatment systems, why it's important, and how it complements what we talked about last week in terms of the spectrum of clinical and primary care intervention services and harm reduction services that have been developed in the area of alcohol and drug abuse. So to start us off with treatment systems, the question is, what is a service system? A service system is an arrangement of resources, and it includes facilities and programs and personnel that's designed to function in a coordinated way. And these service systems have evolved over the past 50 years or so, starting with detox facilities and then rehab facilities and then outpatient programs, and people have gotten trained to work in them. So as the facilities and the programs emerged, they began to take the shape of a treatment system. And it's not only the facilities and the people that work in them, it's the linking elements that coordinate the services. And as we mentioned last time, the functions of this system are things like taking care of people, trying to cure their addiction, and controlling disruptive behavior. The linkages include the connections between specialized treatment services like detoxification for opioid dependence and rehab services or outpatient services where people can be reintegrated into society with the support of mutual help organizations. What we're talking about here at a population level, at a community level, at the level of a municipality or a country, we're talking about population health care management. It's managing the health needs. In our case, it's the substance abuse treatment needs for a defined population within a geographic area. And that defined population is going to depend, or it's going to define whether the people are older or younger, whether they are predominantly males or females, whether they're using alcohol or drugs. So every population is different, and every geographic area may need a different mix of services. So population healthcare management allocates the resources that are needed to keep that population healthy, whether it's preventive interventions or curative and rehab interventions. It all needs to fit the needs of the population. And what is often lost is that these systems evolve kind of arbitrarily. And if we go back and look at them, perhaps we can improve them by finding out how they can best fit the needs of a defined population. And again, that brings us back to population health care management. And that includes providing more economical services. So the systems issues that we're going to talk about are things like, where are addiction services located in different countries? Is it the specialized drug and alcohol services that we've come to know in the advanced economies of the world? Or is it primary care, as occurs when people have alcohol and drug problems in countries where there aren't any specialized services? Or is it the social welfare system, or the criminal justice system, or the medical care system, or psychiatric care? So services are distributed in different countries in different ways. The World Health Organization has done a survey of 133 countries, and they found that the distribution of specialized substance abuse treatment services is the largest chunk of services in many countries, but in less resource countries, it's more towards psychiatric services and mental health and in primary care. But for the most part, substance abuse services across the world are located in either mental health service providers or in specialized treatment services. And these are the two shades of blue in the slide that you've just seen. So what is the optimal mix of services for substance use disorders? As I mentioned, the optimal mix depends on the need of the population. But we've known enough from research to tell us that you need a mix of different services to meet these different populations, ranging from specialized residential facilities for people with the most severe addictive disorders to self-care, where we can teach people how to manage their own substance abuse problems within their families, within their communities, with the support of the professional healthcare system. And in between that, we have self-help groups and we have services in primary healthcare, early identification, and then community-based outpatient services. When you arrange these services, they often, in a well-resourced country like Canada or the United States or many European countries, what they look like is a set of specialty alcohol and drug treatment services, usually outpatient, inpatient, and detoxification, and a bunch of linkages to different types of facilities and programs that are involved in providing other types of services to people in need. So in this case, primary care would be linked to the specialized system because people could be identified early and referred into the specialist system. Mental health facilities often see people with substance use disorders and mental health problems, but people can be referred back and forth to specialty care and mental health care. Drinking and driving programs often deal with people with alcohol use disorders or people who just are apprehended and need alcohol education because they're not dependent on alcohol. The social service and the criminal justice system manage many people with alcohol and drug disorders, and we need linkages to the specialist system there too. So as the system has evolved, it tends to look like a set of specialized services with linkages to all these other services that complement it. And optimally, this combination could serve the needs of the population when it comes to all of the people who have different types of alcohol and drug problems. Now, within these systems, because they're often not designed in advance to function like a system, we have a number of different problems which have been identified by research. Inadequate services. So there are people who have a certain type of problem, like women who are drinking too much and are pregnant, and there are no women's facilities for pregnant women. So the services are inadequate. Or if there are services, many women may not be able to access those services because they don't have health insurance or the distance is too great. So sometimes services exist, but they're inaccessible. In other cases, and in some countries, they may be unaffordable, or they may be there and they're just underutilized. In many countries, the services within the system are fragmented. They exist in part, but not entirely. And finally, they're discontinuous, so that you may be able to get detox, but you may not be able to get people into an outpatient program, and they would need to leave and go back into the community. So this suggests that one way we can improve the functioning of our treatment services is by dealing with all of these common problems in addiction services. How should a society organize its addiction service systems? Well, a number of factors need to be taken into account. the cost of services. Detox is expensive, especially if it's hospital-based, but social detox can be conducted in the community on an outpatient basis for many patients, and it costs much less money. We can improve the coordination so people get into treatment faster. We can use coerciveness in a constructive way or reduce coerciveness so that people voluntarily go into treatment. We can improve coverage so it applies to all groups and doesn't leave out some segments of the population. And we can make our services more culturally appropriate so people feel more comfortable with accessing services. So all of these issues impact on how well an addiction service system is going to function. Putting all this stuff together, we can identify research needs that would help us to improve the system. So we need methods for measuring the extent of services, the quality of services, and the integration. You just saw that pie chart that the World Health Organization did. That came from a survey of health administrators in 133 countries. So somebody had to design that survey, figure out how to put the questions in, and come up with measures that accurately estimated the services in each of those countries so that you could summarize what exists and what is missing. Another system research need is finding ways to determine whether current services are effective at the population level. So is the service system, when it's functioning fully, capable of reducing the incidence and the prevalence of substance use disorders? We'll talk about that in a minute. Another function of systems research is the planning of services. Planning is often based on ideology, on fads, on personal and professional preferences, but rarely is it based on research, estimating the needs for treatment within the population, finding the services that are most supported by the evidence, and trying to create enough services so they meet the demand within the population. So systems research can be devoted to planning as well as describing the current service system and measuring the extent, quality, and integration of services. We've developed a wide variety of measurement tools, just like the measurement tools that we'll be talking about for looking at clinical interventions. There are measurement tools to look at how you can assess the functioning and the performance of a service system. Treatment mapping, it's identifying where the services are located. Epidemiological surveys, you can ask people within a general population survey or within a school survey whether or not they've been exposed to any services, and if so, what types of services and how effective they were. Aggregate data from the healthcare system are often useful, as well as social indicators. These are measures that are collected by governments that reflect how many people are dying of different diseases and what populations come into the healthcare system. All of those data can be useful. We can analyze the system as it's functioning, and we can monitor systems functioning over time with surveys and social indicators. And finally, we can do comparative research, looking at the service system in one country and comparing it to another, or comparing different states or different provinces in terms of the number of services and the mix of services. So we've got a lot of different ways of building a better service system through measurement tools and applying those measurement tools to a description of the system. So to wrap things up, what are the service system issues that we should be attentive to in talking about health services research on the systems of care that have developed within a country or a community? We need to talk about how the public health approach can be applied as well as the traditional clinical medicine approach. And the public health approach, as we've just described, deals with the continuum of care, the whole mix of services, and how those services are linked. It deals with health promotion as well as disease prevention and curative services. It's accountable for defined populations within a region, within a city, within a community, within a country. It provides healthcare at the most appropriate level. So if you have a mix of services, you can find out where people should go and which services would be most effective. And it also means that we're looking for integrated service delivery, that we want these services to mesh together. So that is a public health approach. It differs from the more traditional approach that we've focused on, which has been very useful in telling us how effective acute care is for an episode of alcohol or drug dependence, and how to treat the disorder, and how to be accountable for individual patients, which is what doctors and nurses and counselors do, and how to fill treatment slots and design programs and manage cases. We need both approaches, but the systems approach is going to be, in our mind, just as important as the traditional approach that has been taken to look at alcohol and drug treatment.